This is the Employee Benefits Open Enrollment presentation for employees with Century Payments. Please note that open enrollment will begin on October 16th and will run through October 21st of 2013, with benefits becoming effective November 1st, 2013. Century Payments benefit plans will transition to the benefits provided by WorldPay effective January 1st, 2014. There will be a separate open enrollment scheduled for the transition to WorldPay benefits. As I mentioned, the new benefit year for Century Payments begins November 1st, 2013. Open enrollment means this is the one time each year that you're able to make changes to your elections for any reason that you wish. You may change plans, meaning one medical plan to the other medical plan that's offered. You may add or drop dependents, or you may enroll in plans that you're currently not enrolled in. Now, this is a unique situation because in a few months you will go through another open enrollment period for WorldPay, those benefits becoming effective January 1st. If you don't make changes during the annual open enrollment period, you do have the opportunity to make changes throughout the plan year if you experience a qualifying event. Examples of qualifying events would be if you were to get married or divorced, if you have a baby or adopt a child, or perhaps you're not covering a dependent or yourself because you have other coverage and you lose that coverage. All of those examples would allow you to make changes to your elections mid-year as long as you make those changes within 31 days of whatever the event is. If you miss the 31-day window, then your next opportunity will be the following annual open enrollment period. To the right, you see a summary of the benefits offered. There are no changes to the current benefits that are in place. You have two medical plan options through Blue Cross Blue Shield of Texas. If you choose the high deductible plan with the HSA, your HSA administration is currently through Wells Fargo. And then Assurant is your carrier for dental, vision, life, and disability. If you participate in the FSA, that is offered through ADP. However, that will be discontinued for this rest of this year, 2013, because of the fact that you will be moving on to the WorldPay plan effective January 1st. Before we get started talking about the medical plans, I'm going to take just a few minutes and talk through some terms that are related to the medical plans. Both of the plans that you have are a PPO plan, which just means that you have in-network benefits and out-of-network benefits. However, you do want to pay attention to which providers you see, because the bottom line is anytime you stay in-network, you're going to pay less for those medical services. On the traditional PPO copay plan, you're going to have copays that apply when you stay within the Blue Cross network, anytime you have office visits or go to pick up prescription drugs. And a copay, very simply, is that fixed dollar amount that you know you're going to pay at the time of service, and then the insurance company pays the rest, so it's considered paid in full. You also have charges that apply towards your deductible, and the deductible runs on a calendar year, so that means January through December. Even though the new plan year is beginning November 1st, this does not mean that your deductible is starting over. Any amount that you've already accumulated through 2013 will continue to apply to whichever plan that you're on through the end of the year. When I talk about deductible, that basically means anytime you have surgery done, whether it's inpatient, outpatient, even if it's in the doctor's office, any surgical procedure will apply to that calendar year deductible. Any type of advanced image testing that your doctor may want you to have done, this means MRIs and CAT scans. If they send you to have something done outside of their office, that is a charge that will apply towards your deductible. Any kind of hospitalization applies towards your deductible. And then any type of out-of-network charge will also apply towards your deductible. The importance of staying in-network, as I mentioned before, is that you're going to pay less for the services, whether it's a copay or your deductible and coinsurance percentage. You'll always pay less anytime you see in-network providers. So once your deductible is met, then I'm going to talk about coinsurance. And coinsurance is just a big word that basically means you're going to share in the cost of expenses with the insurance company. So you're responsible for the amount up towards your calendar year deductible. And then the coinsurance means that Blue Cross will pay a percentage of the charge. They'll pay the majority of the charge, and you'll also pay the remaining percentage until you reach the coinsurance maximum. And that's a dollar amount that I'll point out on each plan, where if you reach that amount in any given calendar year, at that point after, Blue Cross will pay 100% for the remainder of the calendar year, assuming that you stay in network. This is the first plan that you have available to you. This is your PPO copay plan through Blue Cross Blue Shield. You have a $30 office visit copay. That doesn't matter. It doesn't matter what type of doctor you see, whether it's a primary physician or a specialist, it's going to be that $30 copay. Preventive care is covered at 100%. If you see an urgent care facility, that's a $55 copay. Then you have your deductible that comes into play, as I mentioned. It's a $1,000 individual deductible, $3,000 for family. That doesn't mean that if you have a family, you have to reach that $3,000 deductible. Essentially, if any one member of a family gets to that $1,000, then the plan will start paying for them immediately. So if as a family, for example, a larger family, say 3 people meet their deductible, then it's met for the entire family. So once you reach your $1,000 deductible, then you have that coinsurance that I mentioned. Blue Cross is going to pay 80% of the charges in network, so you'll have the remaining $2,000 that you're responsible for until you reach a coinsurance maximum of $4,000. That means that your 20% that you're responsible for, as long as you stay in network, cannot add up to more than $4,000 for a total out-of-pocket of $5,000. That's your $1,000 deductible plus your $4,000 coinsurance of $5,000. Your prescription drug copays are $20 for generic, $35 for preferred name brand, and $50 for non-preferred name brand. Anytime you go out of network, you will have that $1,000 deductible that will apply, and then the plan is going to pay either 70% of the allowed amount if it's a doctor's visit, or 60% of the allowed amount for any other types of charges. Keep in mind, though, that that provider can charge you the difference between what their total retail charge is and what the allowed amount is payable by Blue Cross. Please also note that your copays will continue even if you meet your deductible or out of pocket. So anytime you go to the doctor's office or have prescription drugs, you will have that copay that will apply. The second plan is the high deductible health plan with the HSA. This plan is very simple to understand. It's a little bit different than the copay plan that we just talked about. Preventive care is covered at 100%. Again, that applies to adults and children. Anytime you go in for your routine annual exams, including cancer screenings at recommended ages, and that also includes child immunizations. Outside of your preventive care, all of your charges will apply towards your calendar year deductible. So that means any doctor visits, any prescription drugs, any hospital visits, emergency room, lab and x-ray, essentially everything other than your preventive visits apply towards your $2,500 deductible, and then benefits are paid at 100% thereafter for the rest of the calendar year. With this high deductible HSA plan, you do have the opportunity to open up a health savings account. And an HSA, or health savings account, is basically just like it sounds. It will allow you to open up an account through Wells Fargo that you can put money into to save towards your medical expenses for the future. Please note that contributions that are made into the Wells Fargo account will occur for November and December of 2013 only. Then if you choose during open enrollment for WorldPay to enroll in their high deductible HSA plan, you can choose to transfer your current balance from Wells Fargo into the WorldPay HSA account. You'll receive additional information about WorldPay's HSA during that open enrollment, but just realize that you'll be able to make contributions through the Century Payments HSA November and December, and then you'll learn about your opportunities to roll over your contributions and your current balance from your HSA now into the WorldPay HSA. So when you open up a health savings account, you can set aside money pre-tax out of your paycheck directly into the HSA. The advantage in doing so, obviously, is that that money comes out of your paycheck before you're taxed. That money goes into your HSA and rolls over from year to year. So if you don't use it within the given year, it continues to be in your savings account for when you do need to use it for any medical expenses that you or your qualified dependents may incur. When you take the money out of your HSA for any eligible expenses, that money also comes out tax-free. You can use the money in your HSA for any qualified expenses that are eligible per the IRS Section 213D. So just to give you an idea of what type of expenses you can use your pre-tax HSA dollars for, it would apply to any medical expenses covered on your medical plan, including doctor's visits, hospitalization, prescription drugs. It also applies to out-of-pocket dental expenses, including orthodontia for adults or children, vision expenses, including LASIK surgery, and a very large variety of other expenses that you can use those dollars for. I encourage you to take a look at your benefit booklet for additional information regarding eligible expenses through your HSA. You can also use your HSA dollars if you ever want to purchase long-term care insurance or COBRA premium should you ever need to continue your group coverage. The IRS each year determines how much money you can set aside into your HSA, and the amount is determined by who you cover on your medical plan. So if you cover just yourself on the Blue Cross medical plan, for 2013 you can set aside up to $3,250. For the calendar year 2014, that amount increases to $3,300. If you cover yourself and any dependents on the Blue Cross medical plan, you can set aside up to $6,450 total for calendar year 2013, and for 2014 you can set aside up to $6,550. Now the amount that you set aside in the HSA is determined by who you cover on the plan, but please remember that you can use the money in your HSA for any of your tax eligible dependents. That means your legal spouse or children. If you're 55 or older, you can contribute an additional $1,000 each calendar year. In order to be able to put money into your HSA, you must be enrolled in a high deductible health plan, which is the second medical plan that we discussed. You also may not be able to have your spouse participate in his or her medical FSA at their employer unless it is a limited purpose FSA. If they participate in their medical FSA, that will disqualify you from being able to contribute also into your HSA. You may not be enrolled in Medicaid, Medicare, or TRICARE, which is the government insurance. And if you ever decide to take money out of your HSA for any reason other than a qualified expense, then that is taxable as income in that year, plus there is a 20% penalty. It's very important to hold on to your receipts if you open an HSA and deduct money out of the balance, because should you ever be audited, you would just need to be able to document that any money that came out of your HSA, that you had a corresponding eligible medical expense as the reason that you deducted that money. The HSA can make sense for you in a number of ways. If you would like to have a plan where maybe you don't use the benefits very often, it will cost you less out of your paycheck to have the high deductible HSA plan, and it gives you the opportunity to put money into a savings account for use when you do have those medical expenses. You're able to use the money for all of your medical expenses that are similar to the FSA, and it allows you more control over your expenses because you're able to use that money for reimbursement tax-free. So if you have any questions on the HSA or which plan makes the most sense for you, please feel free to contact our benefits broker, CLS Partners. Their contact information will be at the end of the presentation. A couple of things that I just want to mention regarding the medical plans. I think I mentioned before the emphasis and the importance of staying in network when at all possible. The other item I want to mention is urgent care facilities versus emergency room. I'm not saying don't ever go to the emergency room. There certainly are times when the ER is the appropriate place to go. But if you find that you need medical services outside of regular doctor's office hours and it's not a life-threatening emergency, remember that there are urgent care facilities that are in network that are open after hours and on the weekend that will be less expensive than the emergency room. When it comes to prescription drugs, there's lots of things that you can do to help save money. The first being when you go to the doctor and he or she prescribes a medication for you, be sure and ask your doctor for samples because they'll give you those samples. Almost always they have at least a few days supply and those samples are free of charge. Remember to ask for generics, but sometimes if there are not generics, there may be less expensive name brand medications than what are prescribed. So if you go to the doctor and you go to the pharmacy and you have a medication prescribed and it turns out to be a very expensive medication, you may want to ask the doctor or pharmacist if there's any alternate brand names that may be less expensive. Keep in mind also that there are many retail chains that have their own discount drug programs, like Target and Walmart and Walgreens, where if you take a medication on their list, you can receive that medication for either $4 or $5 a month. So that's something to definitely look into as well. We're going to move on to dental insurance. As I mentioned before, dental is offered through Assurant Employee Benefits. The benefits for the dental, it doesn't matter whether you go in or out of network, but just like the medical, you'll pay less when you do stay in network. Preventive services are covered at 100% of the allowed amount. There's no deductible. Then you have a $50 deductible for an individual for basic or major services. Basic services are then covered at 80%. Major services are covered at 50% after that combined deductible. If you're interested in finding out additional information as to what is considered basic and what is considered major services, I'll refer you to the benefits booklet that'll be available for you, and it'll go into much detail on the plan summary. You have a $1,200 policy year maximum. That means that's the most the dental plan will pay out in services. And please note that your preventive services do not count towards that maximum. If you are coming onto the dental plan for the first time this year, please note that preventive services are paid at 100%. There is a 12-month waiting period for any basic services and a 24-month waiting period for any major services that you may want to cover. Vision is also offered through Assurant, but the network is the VSP network. So if you enroll in the Vision plan, you want to make sure that you're utilizing a VSP network provider. You have a $10 exam for your office visit exam once a year, and a $25 copay for lenses. That lens copay will cover just about everything to do with your lenses, whether they're single, bifocal, trifocal, but you may be paying extra for the extras that are add-ons like the scratch-resistant coating, etc. You have a $130 allowance for contact lenses, as well as a $130 allowance for frames. You can receive an exam once every 12 months, lenses, either lenses with your glasses or contact lenses once every 12 months, and then frames once every 24 months. Century Payments provides a basic life benefit for all full-time employees that you are automatically enrolled in. You also have the opportunity to purchase additional life insurance coverage for yourself, spouse, and/or children if you would like to do so. If you have not previously enrolled in the voluntary life, or if you have enrolled and want to increase your amount this year, please note that you do have to complete a statement of health answering medical questions to be approved for this additional life insurance coverage. Employees can purchase increments of $10,000 up to 5 times your annual salary, and if you purchase coverage for yourself, then you can also purchase coverage for your spouse in increments of $5,000 up to half of the amount that you elect for yourself. And children you can purchase in the amounts of either $1,000, $5,000, or $10,000 not to exceed 50% of your amount. But please note, if you do make application for this voluntary life insurance, you will be required to fill out a statement of health and be approved for the coverage. You are also automatically enrolled in both short and long-term disability. Century Payments provides this benefit for all full-time employees. Short-term disability, if you are unable to work due to illness or injury, begins on the 8th day of being out of the office and qualifying for disability. Short-term disability pays 60% of your weekly earnings up to a maximum benefit of $2,000, and your short-term disability benefit can go for a duration of up to 11 weeks. Please note that for standard maternity benefits, it's typically a 6-week benefit. However, if there are complications, that can extend up to 11 weeks. Long-term disability begins on the 91st day of being unable to work. 60% benefits of your monthly earnings up to $6,000, and the benefits for long-term disability, if you are totally disabled and continue to be, can pay up to your Social Security normal retirement age. The flexible spending account that you may be participating in will continue through the end of the 2013 plan year. Remember, your flexible spending account allows you to set aside money out of your paycheck on a pre-tax basis to use for eligible medical expenses. Medical expenses covered under your medical plan, including deductible, coinsurance, and copays, as well as out-of-pocket dental and vision expenses, and any eligible expense indicated in the IRS Section 213D. Please note that FSA will not be included in the current open enrollment period. The FSA program that we have in place is a calendar year program running from January through December. So if you currently participate in the FSA, it will continue through the end of 2013, and then you will have the opportunity to enroll in the new FSA through WorldPay's benefits during open enrollment for the 2014 calendar year. Please remember that if you have any questions at all related to the benefits explained in this presentation, you may reach out to our broker, CLS Partners. They can answer any questions related to the benefits and help if you need questions answered on providing in-network doctors for you and your family, as well as any claims assistance. Please reach out to them at support@clspartners.com, and we've also indicated their toll-free number for you as well. Please remember that if you choose to enroll in the HSA right now, you will need to open a health savings account with Wells Fargo before you can contribute any money into the HSA pre-tax. And if you are enrolling or increasing your voluntary life amount, you will need to get the statement of health to complete for us to submit to Assurant to be approved for coverage. Our open enrollment period begins now. You will need to go online and go through the open enrollment process through ADP. Again, remember to update your statement of health and submit that for the voluntary life insurance, and also to update your life beneficiary if you've had any major changes through the past year. You must complete the annual online open enrollment process by going online and reviewing and electing your new benefits no later than October 21st. Again, if you have any questions related to the benefits in this presentation, please feel free to reach out to CLS Partners. If you have any questions related to the open enrollment process through ADP, you can reach out to the Human Resources Benefits Department at Century Payments. That concludes the presentation. Thank you for your time.